This is Nicholas. I'm welcoming you to my YouTube channel. Today we are going to learn about an aspect of health and wellness. There is something called health wellness continuum, and that is the topic of the day. We are going to focus on health wellness continuum. When we talk about continuum, it's just about we are talking about something which is a line, okay? So in terms of our health and wellness, we are moving along a line, okay? We are moving along particular line. So as you can remember, we talk about many elements of wellness, and there is also many components of health. So you are looking at something specific, and that something specific moves along the line, okay? So maybe in terms of something like physical health or physical wellness, it moves along a line, okay? You go to your financial health or financial wellness, it also moves along a line. Social wellness moves along the line. Occupational wellness moves along a line. Environmental wellness moves along a line. So consistently, everything is actually changing. What matters is your ability to adapt and to change according to prevailing circumstances or situations. Okay, as you strive to optimize your potential and exploit your capabilities, your skills, uh, and opportunities in life. So I will go to cross-examine what we call uh, mm, what's called health wellness continuum. So health wellness continuum is actually, it appears like a line. So I will use this ruler to demonstrate what health wellness continuum is. So health wellness continuum appears like a line. Hypothetically, we just assume it appears like a line. And for this purpose, I'm going to use this ruler. So this ruler, for your information, is a 30 centimeters ruler. So it starts from 0 up to 30 centimeters. But let's assume that on midway, the midway of this ruler, okay, it's 0. So we are not actually talking about centimeters or anything else. We just took, use random figures, okay? So on the middle, there is 0. And then you move towards the right. So that's 1, 2, 3. And then, and onwards. And then towards the left-hand side, there is -1, -2, -3, -4, and so on towards the left. So the reference point is 0. Then there is that move towards the left, towards the negative side, and there is that move towards the right, that's the positive side. Okay, so when you are at 0, it means more often you are not striving to do anything. You are just fine. You are at good, to say, good status. Okay, so 0, I will use an example so that you can see. For example, somebody who is healthy doesn't have any disease, okay, and then is diagnosed with high blood pressure or hypertension. So when that person is diagnosed with hypertension, does he move towards the positive side or the negative side? He moves towards the negative side. Okay, so let's say, for example, he moves towards -1. Okay, the person does not control hypertension, doesn't go to hospital, so the value of readings, blood pressure readings, continuously goes up. Okay, because he's not controlling hypertension. Okay, so as conditions or our conditions or his condition worsen, his hypertensive condition worsens. he moves towards the negative and more negative and more negative. So the severity of the disease worsens. So that person will move towards death. Okay, there is increased chance of mortality. Okay, you are likely to die if you move towards that direction. You are not controlling it easy. And again, if this person uh, fits, visits doctor, gets medication, doctor positive lifestyle, manages the disease, the blood pressure reduces. So this person will move towards the right. How to get? So you will move towards the right, positive one, positive two, and onwards. Okay. So that person is likely to live a better life and die at maybe appropriate age, if it is 70, if it is 80, if it's 90, okay, according to many different factors which can determine lifespan of an individual. So this is what we call healthy wellness continuum. So you use healthy wellness continuum to assess any disease, any aspect of wellness. Okay, we have many aspects. For example, financial, you can use also this scale. If you do not have any debts, okay, maybe, and you are not making money, you are living from hand to mouth, maybe you are at that point zero. Okay, so if you have now a lot of debts, you are going into deeper debts, you are borrowing a lot of money and it's piling up, you are not repaying. So that one, you are moving financially on the negative side. You are moving towards adversities. Okay, so on the other hand, if you learn to manage your money well, or you are having a better income, you have a better job with good income, better revenue, you don't have any debts, or if you have debts, you are doing business which are doing well, bringing in a lot of financial flow. So you are moving towards the positive side plus the positive side, plus one, plus two, plus three, and so on. So that's what we call financial wellness. So these things, financial analysts or financial consultants can help you with this. But now this is having an idea of what we call wellness continuum provides you with an avenue to get some understanding that you are always on a scale. Okay, you either move towards the negative side or positive side. In terms of something like a social wellness, okay, there are those people with maybe they like living alone and they feel good about that. Okay, they still optimize their ability. They are overcoming their own challenges. They are exploiting opportunities. They are living their own potential. Okay, so those people, we can say, still, even if they are, you can say they don't have friends. Okay, uh, they do not have friends. They do not have. They do not interact with many people. Okay, but they feel that is favorable to them. So still, we cannot say those people are all negative. Okay, those people, they can adapt it to loneliness. They can manage loneliness. They can control loneliness. So those people, we can say they are socially on the positive aspect. So if another person relies on social, they rely on people. And when he lacks people, he feels bad. He feels unwell. Okay, he feels stressed. That person will now be going towards the negative side. So healthy wellness continuum provides us with a broad understanding that we are not static. Okay, in terms of healthy and wellness, we are never static. We are in constant change. So healthy wellness continuum is just a framework. It's just a way of understanding that we are on a continuum in which you can decide to move towards the right side, positive side, okay, by lifestyle changes you make, okay, by the decisions you make on every aspect of your life, okay. And also, if you are overcome by challenges in life, you are likely to move towards the left side, the negative side now. Are you together? If you don't make decisions that favor you to move towards the right, then you will move towards the left. Okay. So that is generally the presentation of the day, wellness and health continuum. Very special to understand. Thanks for attending this session. If you are first timer visiting this YouTube channel, I request you to hit the subscription button so that next time I upload a new video, you can watch for a few minutes or so and learn something new. Bye.